So how are data and AI changing or maybe revolutionizing life sciences today?
So, Karen, it's actually revolutionizing in many ways. So, one is that actually the healthcare industry is one of the most innovative, actually, I would claim the most innovative industry in the world.
Mm.
No other industry has to, particularly in the pharma life sciences industry, has to replace 100% of its revenue every 10 to 15 years because products go off patent. Imagine if Boeing had to basically retire its plane every 10, 15 years, or Microsoft couldn't sell Microsoft Office after the first 10 or 15 years. They would be very different companies. So when you live in an industry which is very innovative, it is constantly changing. So that is one part. The second part is that it's also a very regulated industry, which means that everything is tracked. Well, when you put systems in place and when they are tracked, that produces data. The third piece is that the decisions you make have consequences, consequences of people's lives. So there is an enormous amount of responsibility in making responsible decisions. So that is the background. Now, from the data perspective, we've always been blessed with a lot of data, and the data keeps on improving, right? So, for example, in United States today, we are one of the most automated industries there is. So, if you look at healthcare records, patient data, all anonymized is highly protected within the very strict both letter and spirit of the HIPAA guidelines. But the richness of the data that and actually you can link a patient and actually track a patient across their whole lifespan gives you very rich data. So that enables you to do three things. One, you can actually improve on the processes that you already have because you have better data, you make better decisions. Second, you can actually put the decision making in the hands of the key decision makers, whether it's a pharma rep, whether it's a doctor, whether it's a insurance company, so that they can actually make the decisions rather than going to someone and saying, can you do this analysis and give me a PowerPoint or a spreadsheet and actually make this analysis. The third thing is, how do you do things that have never been possible before? And AI, and particularly Gen AI, enables you to now do things that actually were not possible to do with the traditional analytics and AI.
Can you give me a use case where your product has been like successful in overcoming some of these challenges?
Yeah.
But helpful in helping your clients overcome these challenges?
So Karen, I'll give you a few examples. So one of the biggest drivers of innovation in the pharma life sciences industry has been treating rare diseases. By definition, a rare disease is something which is a very small population actually suffers from rare diseases, these diseases, and most of these are genetic diseases. Look, we actually decoded the human genome less than 15 years ago. And with that knowledge, with this understanding, with actually ability to actually run a whole genetic test on makeup of every human enables us to actually find the causes of these genetic diseases. FDA has identified more than 7,000 rare diseases, 7,000, and less than 5% of them currently have any treatment. So you see, we're just getting started. But just look at the ones that already have a treatment. For the right patients, these are miracle drugs.
Sure.
But if for whatever reason, the patients cannot get this drug, it's a huge loss to the society. That's where our AI and analytics comes in. We find that needle in the haystack of actually alerting where those patients are or could be, where the patients are in their journey, so that you can actually do a timely intervention. In most of the diseases, the complex diseases, the time from onset of a disease to actual treatment, the time span is more than 8 years. If by using analytics, you can cut it at in half, can you imagine the impact that you can make? So those are the kind of analytics that we run in finding patients, in doing the right intervention, in helping pharma companies understanding how the patient journeys are, how their products are being used, what impact is happening, how the real world data that now we have, how is actually we are measuring impact, both the medical impact as well as the financial impact of that. All of that is now possible with AI and GenAI.